So when I tried to record further, it stopped. So I'm going to continue on now from where I left off. So I wanted to give you an idea of what I heard with her lung sounds. Listen to this. That's what stridor sounds like when you auscultate the lungs. Okay. Now, stridor is an inspiratory wheeze that sounds like a whistling sound. Okay. Now, let's move on to the next thing that I heard. Okay. This was her cough. It sounds kind of like a barking or almost like a seal, like, you know. So that is a very distinct sound that just, when you hear it in another child, you're going to easily be able to identify Croup. Okay. So let's move on. I do want to kind of give you a little bit of background. The Croup refers to an infection of the upper airway which obstructs breathing and is a characteristic of that barking sound. Okay, so you're going to have typically fever, hoarse voice, and breathing that might be noisy or labored. The second differential was bronchiolitis. That's part of the spectrum of lower respiratory tract diseases. It's a major illness and hospitalization in infants, and basically it's a narrowing of the windpipe. Okay, so she had already dealt with that in January, and that was hence what all of the steroid inhaled budesonide and then the albuterol was given to her for. So moving forward, we are going to talk plans. So diagnostics, vital signs must be taken, auscultate lung sounds. All of this is going to mainly be diagnosed on a physical exam. So based on O2 saturation, patient presentation of signs and symptoms like labored breathing, difficulty swallowing, or development of gray-blue skin around the nose, that is a transfer immediately to the emergency room, okay? They need to do an x-ray to assess further her lung capacity. But this patient, I'll get into what her treatment was for me because it wasn't to that level of need. Okay, recommended ibuprofen 5 to 10 milligrams per kilogram dose, POQ 6 to 8 hours PRN. Based on the patient's weight of 20 illables, she can receive 5.45 to 90 milligrams per her weight. This patient received an in-office albuterol inhaled nebulizer treatment as well. The dose is in my SOAP note. This is for mild to moderate acute bronchospasm. After in-office treatment, her oxygen improved from 94% to 97%, which is fine. If necessary, esophageal dilation is an option for this patient. Now, esophageal dilation is something that a whole team's going to need to be involved in. The pediatrician refers then to a pediatric gastroenterologist, and then they then further team up with an ENT surgical team, okay? Because this is not something that is yes, it is a one-day procedure, but there is risk to it, okay? That's where they put in your esophagus a balloon that helps expand and dilate that area. So if her breathing and swallowing becomes further an issue, she should absolutely look into that or be referred. Now, education for the family is recommend at-home steam bath to soothe swelling within the throat. This helps promote better breathing. Recommend lots of liquid to prevent dehydration related to fever. Light clothing and lower room temperatures are recommended to reduce her fever as well. Now, follow-up will be within 24 hours. I just want to follow up with her to make sure that her fever is in check. An in-person follow-up should be scheduled a week out to assess. I want to listen to her lungs again and make sure the stridor has improved. I absolutely encourage the mother to call 911 if patient worsens, breathing becomes more seriously labored, or patient's coloration lightens from potential hypoxia. The mother did verbalize understanding. Now, the other part of this is the holistic approach to caring and science. So qualities I've always admired in heroes is strength, persistence, and determination, knowledge, and compassion. These are things that I wholeheartedly feel that a nurse practitioner's role and influence mean to me and what we need to carry bedside. With my future role as an APRN, I hope to exemplify these characteristics. Exploring the influence of Gene Watson's theory of human caring on my future role is critical in creating a holistic experience and improving the health outcome of your patient. The concepts and credas possessed from the theory of human caring by creating an occasion caring moment, which is heart-centered encounters with another person, is what I utilize most. I find it necessary to uncover life's experiences, understand the goals and expectations of each patient. Being aware of their cultural background and honoring their core better provides a connection to both of our spirits. This is a patient that's clearly family oriented. She lives with her mother. So I want to make sure, as a new mom, she's only 13 months, her baby, I want to make sure that she feels comfortable, she feels safe in caring for her. And also, I think it would be very important to involve the grandmother, since she is a caretaker for that baby 9 to 5. And together that will just create a solid team to really support this baby through her congenital abnormality and just help managing, her acute laryngitis, her croup. So I hope you've enjoyed, and thank you so much for watching.